In this equation, of course, the medicine, the doctor, but also there is the patient. And this is a new concept and related to the Romanian population. I'd like to ask Oana Cuzino, which is your opinion on personalized medicine, and how do you see all this information going directly to the patient?
First of all, as a medical doctor, I want to express my enthusiasm regarding all these gene-based therapies in order to help patients and doctors to predict, to prevent, to diagnose, and also to treat patients. But as a medical journalist, I can say we are speaking about changing mentality, at least here in Romania, and of course mass media is playing a very important role in order to translate all this expert vocabulary to simple, actionable messages to the people. Referring, for instance, to pharmacogenetics, it's quite hard to explain even to the doctors, to the family doctors, for instance, because I spoke with them, but also to the patients and their family, why some patients with breast cancer has to follow another therapy, not chemotherapy, but hormonal therapy. And I made a very short personal research on my Facebook page. Day before yesterday, I launched for 24 hours a question based on Angelina Jolie's recent experience, and I just asked the people what is their opinion. And I had almost 100 relevant answers and comments. And there are some good news that the people are really open, and if they have this opportunity to save their lives, they're into it. But their comments relieve that they're not very familiar with these new procedures. They really didn't understand what happened, what is all about this genetic testing. And for instance, they said, okay, she made these surgeries, but the cancer is still there, so it show up in another part of the body, and what she will do next. And so all these comments show that the people they really need these informations. So to have this demand that the demands for these new technologies, as Professor Zmai said, we really have to assume this social responsibility as mass media and to explain very clear to the people what all these new technology are about, and also to stay connected with the specialists. I mean, we are only a tool in this equation. We have to take these informations from the specialists and then to ask the people to conduct them back to the specialist, because some of this testing needs some decisions, very important decisions. Even the person is healthy and young, and is just finding out that someday could develop a certain disease, important disease, or if they are already sick, suffering about any kind of disease, and they can apply to pharmacogenetic to improve the therapy. And I'm not speaking only about the cancer. Of course, the cancer is very frequent and kind of terminal disease, but we are speaking about any other kind of disease and therapy. Another question that lots of people addressed me in this regard was about the price, and which are the differences because some tests are you can find in Romania and there are a few hundred lei and others are a few thousand euros. And they refer to the test that Angelina Jolie made, and they ask how can we get this kind of test and why to pay so much. So based on all these comments and questions from my respondents, I decided to try weekly to bring a specialist close to the people to give all these informations, and of course to come up with new strategies that compose this effective personalized medicine.